Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day. And we'll say hello to a few friends here. Let me just get this on here. Here we go. And who's number one here on the hit parade this morning? Mike from Norland. And Andrea, Niagara Falls. How are you? And let's see, who's coming up here? Sandy, Minnesota. Fran, Orangeville, good morning. Nativity, how are you? And there's Kevin, how are you? Dan, good to have you on this morning. I'm just trying to put my microphone on here. And Nellie, how are you? And Evangeline. Okay, Jeanette, how you doing? And Burlington, that looks like Gertie. Linda, how are you? And Berks Falls, who was it? Rose. It wasn't Rose. Rose came up next. Dave, Muskoka, Brahim, how are you? And Gina, good morning. And Karen, how are you? Tina. And Wendy, Markham. Donna, how are you? Okay, I'm going to bring this over here. Nancy and Anne. Maybe if I see it over here. No, that doesn't help. Okay. Jeanette, and I missed two that went by me. Into the Clouds, David. Donna and Beverly. And Yolande, bonjour. Susan, Cape Breton, Nova Scotia. Francis from Vaughan. And Judy, getting her vitamin C coffee on the deck. Beautiful. Elaine, Jude from Troy, New York. I didn't mean to miss you, Jude. Donna and Barbara from Naperville. Joanne, Berks Falls. Norma, Tyler, Texas. Carol, good morning. Sue, how are you? And Kathy, BC, bright and early. Thunder Bay, Diane. And Maureen from Penticton, British Columbia. Shelley. And Doc McEwen, our dear friend. Lenora, how are you? And I think Terrace Bisou, who is that? Donna. See, goes up, guys, into the clouds sometimes. And Sharon says I'm one of the ones who I missed. Teresa. Rachel. Two more, guys. Georgie, Halifax, Nova Scotia. Melika. And said I missed her too. Kathy, I'm glad you came back up because, guys, when I miss you, it's because I don't mean it. Yvonne. April. Good morning to you. Sherry from Mississauga. Anna. And Elaine, good morning. Barbara, Nova Scotia. And Kathy from Simcoe. And Mary from PEI. Guys, love you dearly. And I can't see the last one. And Sandy. Okay, do you think I'll ever get this microphone on here? Okay, let me do it now. And then let's get to our questions. There. Okay. Drove me crazy this morning. Questions. Here we are. Okay. And up first is Maria. How are you, Maria? Hope you're on with us this morning. My daughter has a master's in nutrition. Good for her. Yesterday, she advised me that since I am eating meat, cheese, and eggs, EMC, eggs, meat, and cheese, there is 100% guarantee I will end up with colon cancer. That did shake me up a bit. Maria, look, and I don't mean, okay, now listen. Maria, your daughter, okay, your daughter is no dummy. She's got a master's degree in nutrition. But I just got to tell you, I got trained. I got a PhD in nutrition. I got trained like your daughter did. Okay? I got trained like your daughter did. Meat, bad. Fat, bad. I got trained like that. I've often told people I had to undo my training. Now, Maria, let me make a couple of points, okay? And this is, tell your daughter I love her and I don't even know her, okay? And I get it. I understand where they're coming from. But let me give you a couple of things, okay? Number one, colon cancer is up 500. I posted this 2 or 3 weeks ago. Colon cancer is up 535% in the last 20 or 30 years. And where it's really surprisingly up is in young people. Because one time, colon cancer, colorectal cancer, was an old man's disease. Primarily, an old man's disease. Today, it's a young person's disease. Now, let me say this, Maria. Meat consumption, animal product consumption is down 30%. We're eating less meat than ever. Because the world out there, including the nutrition gurus like your daughter, they're being taught that animal foods, animal products are lower on the food chain than fruits and vegetables. It all started to get people away from cholesterol, get people away from saturated fat. And they said, here's, I'm quoting, when you eat meat, it's acidic, okay? It's acidic. And then it rots in your gut. It's the opposite. Cancer hates steak. Hates it. Because they can't feed on it. Cancer needs fuel. The fuel, and we had a little discussion right on our private Facebook group. I can't even remember the guy's name, who was saying, well, Dr. Martin is wrong about sugar. Sugar doesn't cause cancer. Well, you know, I brought him to the PET scan. Not for your pets, but for imaging for cancer. Okay, it's the latest imaging for cancer. It's called a PET scan. And before a person is put into the scan, they're given glucose, sugar. Why? Why are they given sugar? Why aren't they given steak? Here, we're going to grind up some steak. We're going to give it to you. And then we're going to put you in the PET scan. And whether you have cancer in your brain or your toes, when you take the glucose, either drinking it or they put it in IV, that sugar goes right to the tumor. Why? Because cancer needs to be fed. And look, I agree with, I can't even remember his first name. I'd have to look it up again. I agree to the extent that, you know, sugar isn't the only cause of cancer, but sugar sure feeds cancer. And we've known that since the 1920s. Do you know that Otto Warburg, and he was a Jewish person living in Germany. Yikes. But because he was so smart, the Germans preserved him. They let him do his research. And one of the things that came out of it was a book called Ravenous. And what he was talking about was glucose fuels cancer. Cancer cells are ravenous for sugar. We knew that in the 1920s. He won a Nobel Prize in medicine. He was no dummy. But you know what? The world, you know what? They dismissed it. They shouldn't have, but they did. Okay? And so, all I'm saying is, Maria, that the facts are that your daughter, and I think she'll learn this as she, goes on in her career, that she's been duped. She's been duped. Listen, okay? I'll tell you why I wasn't duped. Because I went into nutrition knowing that sugar was destructive. I've told you that a million times about my father being a diabetic. And in 1968, I'll never forget what he said to me. Son, it's sugar diabetes. Meaning, Dad, why aren't you taking any more sugar in your diet? Because it's sugar diabetes. And then, as we got into the 1980s, and they flipped the sugar, they went to high fructose corn syrup, and that, my friend, has brought on a tsunami of cancers. I'm not saying it's the only cause, but I'll tell you one thing. If you got cancer, run, Forrest, run from sugar. Not steak. Don't run from steak. You can eat steak. As a matter of fact, I recommend you live on eggs, meat, and cheese if you got cancer. And you can have a few vegetables and limit even your fruit. I'm not saying no fruit, but I would limit it. So, yeah, that did shake you up, Maria. That's your daughter. You respect that. They just understand. It's just like if you had a child or a sibling or whatever in medical school, God bless them. They're smart. Okay? You can get into medical school. You got a brain in your head. The problem is what they teach you. And what they teach you in nutrition, and even to master's degree in nutrition. It's 100 years old. And they look at eating meat and eggs and cheese. Well, you better limit those. And some of them would say, I wouldn't eat that at all. Because, again, like I said, what they've done on the food pyramid is they put fruits and vegetables and grains as number one on the hit parade in terms of your health. Fruits and vegetables and grains. It's the opposite. It's the opposite. It should be on the bottom part of that pyramid is eggs, meat, and cheese. Because eggs, meat, and cheese are the most nutrient-dense foods. And it's not even close. And cancer loves crap. C-R-A-P. Crap. Cancer feeds on crap. Okay? And again, I know there's environmental factors, there's other factors, but I'm telling you, one thing you can't control is what you put in your mouth. So, and anyway, I could go on for an hour. I love that you question that. I think I try and prepare you for the world, in a sense, coming after you and saying, that Dr. Martin, he's a quack. Okay? And I heard it all my life, guys. I heard it all my life. There's a verse in the Bible. Okay? Proverbs 23 and 23. Get the truth and never sell it. I love that verse. Get the truth and never sell it. Hold on. Hold on to the truth. Okay, thank you, Maria. We appreciate you being very forthright. Louise, my doctor wants to send me for a sleep apnea test. Okay, and she says I won't lose weight if I have it. Is that true? No, not really. It's the other way around, Louise. If you lose weight, sleep apnea, guys, you know what it is? Okay? Now, most answers will say it's a lack of oxygen to the brain. That's why they have sleep apnea machines. But that's not the cause of it. What causes the lack of oxygen to the brain? Sleep apnea is fatty tongue. I don't talk about that enough. You can get fatty liver and you get fatty tongue. Fatty tongue caused by the same thing that causes fatty liver. Why do we see so much sleep apnea today? Think about it. Why is it? When I was in practice, even in when I started in the 1970s, sleep apnea, never even heard of it. I didn't take sleep apnea in school. I'm not saying that it didn't. It's like autism. Honest, guys. I know autism is well established today, but you just understand that when I graduated in 1974, I never even heard of autism. Okay? I didn't hear of it. And secondly, I never heard of sleep apnea. Ever. Now, maybe we misdiagnosed it. Maybe we didn't realize people had it. But I'll tell you what. Today, those are epidemics. Autism, sleep apnea. And I'm a guy that goes, here's how my brain works. Why 50 years ago we didn't have it, and today we have it, and it's an epidemic? I wonder why. I wonder why 50% of the population is overweight. 50. Why do we see fatty liver? I never even studied fatty liver in the 70s. Fatty liver, fatty tongue, Louise. So it's the opposite of what your doctor said. Now, if you can, you get your insulin down, you get your weight down, you get your fatty liver down, your sleep apnea is going to get better. Now, I'm not telling you not to go get tested. I'm not telling you if they tell you you need to be on a machine. I'm not telling you not to do any of that stuff. But at the end of the day, you better change your diet. Okay? And that's how I treated sleep apnea in my practice. I said, look, you got insulin resistance, probably with some fatty liver, and let's get rid of that. And let's see what happens to your fatty tongue. Fatty tongue. Okay, are we having fun yet? That was Louise, and Grace is asking, is fly repellent okay to use on the skin? Regular, if not, like the DEET. Well, listen, look, if you can get a natural one that works, okay? Spraying oil of oregano or mixing up a spray of oil of oregano, I find can be very, very effective. Even better for bites, but as a repellent. Bugs don't like oil of oregano. Any kind of bug. Okay? Now, if you got to put DEET, you're in the bush and you're out camping or whatever, look. Anything you put on your skin, if it's a chemical, that's how you get it into your body. But if you're doing it 100 times, look for a natural alternative. And I bet you people here will give you some ideas here, Grace, on what to do. Okay? If I told you I never used, you know what my idea of camping is, by the way? The Holiday Inn. I tell my grandchildren that. Okay? Like, Grandpa's not a camper. Okay? I'm a happy camper, but I'm not a camper. Okay? Like, I want to go camping, I go to the Holiday Inn. Okay? Like, I think I got that from my mother, who was a clean freak. And, even though we had a cottage when I was a kid. Okay? Anyway, I'm just joking. Okay, and Claude is asking about, what do I think of ice baths? Are they good for you? So what is the temperature, how long, and how many times a week? Well, look, I don't know. Like, I read all about taking an ice bath. You know what I know? Let me just say this, Claude. I know what's even better than an ice bath is a sauna. Sauna. For my Finnish friends. Serpa, are you listening? Okay? Because she says sauna, different than I say sauna. But saunas are good for you. Now, I'm not saying an ice bath. I've read the research on it. Seems to be encouraging. But one thing I do know is the research on saunas are really, really good for you. A sauna is really good for you. Ice baths, I remember, I haven't done it in years, but I remember, we go out to a friend's cottage in the winter and we get in the sauna and then go jump in the lake with, they dug a hole in the lake. I remember doing that. Or jump in the snow. Okay? But, Claude, good question. I think it's all right. But, therapeutically, is it good for you? Probably. I think the heat is better for you than the ice cold baths. But I understand it. I read the research. Liette, for the last few months, I've noticed my joints are inflamed. I can't wear my rings anymore. I've gained weight and mostly by eating EMC. Any suggestion on what to do? Well, Liette, let me get you to differentiate for me. You're going to have to give me more information, okay? So send me information via email at info@martinclinic.com. Okay, send me more information because I want to differentiate. You say inflammation, and I would ask you the question, Liette, are your joints sore? If they're not, it's not inflammation. It could be edema. Now that's different. Edema is swelling of your fingers. You can get it in your feet, around your ankles. You could be dehydrated to some extent. But inflammation, when you have inflammation, not edema, but inflammation, you're going to have pain. You don't get pain without inflammation. So, Liette, I need to know whether your joints are sore or not. Not whether you can't get your ring on, because that could be edema. And that's different. That's usually, has to do more with the potassium, sodium, okay, at the cellular level. And that can be dehydration. And you get edema. And with the heat, you can get edema. Okay? So I need to know the difference, Liette, because I can't give you the right answer. And it has nothing to do with you eating eggs, meat, and cheese. Okay? Because you're eating the right things. Rita, why do I bruise so easily? Because you're weird, Rita. No, I'm teasing today, okay? I'm in a teasy mood. No, Rita, look, you could be, there's a lot of reasons. I just get a scratch, a bug bite more on my legs and I bruise. Well, okay, Rita, like a couple of things. And again, I don't know. Are you on aspirin? Are you on a blood thinner? I need to know that. Because that happens. And some people just bruise easier. Okay, they just knock their skin and they get a bruise. I'm not too worried about it unless you're on meds. Okay? You're on meds. I need to know that, Rita. So the same for you. Give me more info. Info@martinclinic.com. Send it in, and then I'll answer your question even more specifically. Sil, is calcium lactate, is it good for reducing mucus in my throat? No. Why? Mucus in your throat, okay, it's either coming from here, sinuses, or coming from a silent acid reflux from the stomach. Because that's where mucus in the throat comes from. You either got postnasal drip, more likely, but you might have a silent acid reflux, meaning you don't feel the acid, but you got a lot of phlegm in your throat. And so, two things. One, if it's postnasal drip, don't feed the bears, because what's in the sinuses when it becomes chronic is yeast. It's a fungus. It's candida. Don't feed it. Lay off the sugars. And even if it's a silent reflux, sugar and crappy carbohydrates, if you're a carboholic, if you're a person who gets duped, like, who was the first one? Maria's daughter. Duped. That fruits and vegetables are better than eggs, meat, and cheese. Well, you know what? You use your stomach or lose it. Your stomach was designed. Its acidity levels were designed for you to eat meat. If you don't, you're making a big mistake. And your pH in your stomach is going to go up. You don't want your pH to go up in your stomach. You want it to be very acidic, more acidic than a lion. You were designed to eat steak. Designed. Okay? You were designed for it, your stomach. I often ask people that. If God wanted you to be a vegetarian, why did he give you a stomach that is acidic? And so acidic that it was designed to mulch down meat. Anywho. Okay. Let me see. So Sil, yeah, calcium lactate. No, don't take it. Thenia, Esequol, safe for menopause symptoms. Can it cause cancer? You see, Thenia, look, I'm glad you brought this up because I want to talk to you guys about this. Okay, because I think it was yesterday, it might have been the day before. And someone, okay, and I should have wrote it down, their names, okay, because I love when you guys put stuff on our private Facebook group. Dr. Martin, okay? Well, they didn't ask me the question, but they put it out there. I'm very suspicious, okay? A couple of people said this, and they're following, meaning that, yeah, me too, I'm suspicious. Because Dr. Martin tells us to eat flax seeds. And my doctor, my naturopath, my guru told me that's a phytoestrogen. Don't take it because it increases your risk of cancer. I get a headache. I get a migraine. They're phytoestrogens. Okay? Phyto doesn't mean xenoestrogens. Phytoestrogens. Flax is a phytoestrogen. Soy isoflavone is a phytoestrogen. But they don't increase your cancer. They decrease it. They decrease it. And I've taught you this. Why do I like flax seeds, even though it's a phytoestrogen? Because in it is 100-fold lignans. I'm not making that up, guys. It's got 100 times more lignans than anything else. That's why it blocks estrogen. I probably don't. Maybe I do. Maybe I do. I'm going to show you something. Okay? I'm going to show you something. Now, this is my old days in practice. I used to measure estrogen on your skin. Okay? Now, I'm going to show you something. Okay? So the folks listening, visualize this. Okay? This is a scan for estrogen. You guys see it? See this lady here? See the red? See the black here? See that black, guys? Okay? See the red and black? The black, especially on this, excuse me, the other side here. See the black there? That's estrogen. Estrogen is a growth hormone. This is before, okay? This is after. Same woman, 6 months later. You know what's happened? Oh, all the estrogen is gone. You know how I did that? I blocked it. You know what a phytoestrogen is? Flax seeds and dim. It comes from an extract of broccoli. Okay? It blocks estrogen because what it does is elevates your progesterone. And I can prove it to patients because I used to do estrogen testing. And women like this were very, very susceptible to breast cancer because of all the estrogen around their chest wall, in the breast tissue. I said, man, you got to block that. You got to get rid of that. What did I give them? DIM, our hormonal formula, and flax seeds. Because of lignans. Block that extra estrogen. You don't want to get rid of estrogen completely. You're a woman. And men, when they get prostate cancer, they got too much estrogen and not enough testosterone. It's not that complicated. Okay. Is Equical safe? I didn't even look it up, but I think it probably contains a phytoestrogen. Yeah, I like it. I like my menopause formula better because I make it better. Okay, Kim, I have gastritis. The pantoprazole, yeah, has helped with the burning in my stomach. I take probiotics. What else do you recommend? Digestive enzymes. And as soon as you can, Kim, get off the acid reducers. Get off the acid blockers as soon as you can, because you're just masking the symptoms. You're not fixing the problem. The reason that you have acid reflux is because you don't have enough acidity in your stomach. It's not too much. It's your body compensating because your pH has gone up in your stomach, Kim. And your body's smart. It says, I got to produce more acidity. And then when it does, the proton pumps produce it, and it starts going up the esophagus, and now you got acid, and it's no fun under the sun. Change your diet. Lay off the crappy carbs. Take digestive enzymes with every meal. Okay? Makes a difference. Really does. Okay? Nice. Hey, listen, you need temporary relief. You can't stand it. I get it. I'm on your side, Kim. Okay? But okay. Janet, my iron levels are low. Could coffee affect this? No. No. Coffee's good for you. Coffee's not going to hurt your iron. Okay? Coffee's not going to hurt your iron. If your iron levels are low, by the way, I'd recommend you get on I used to call it Blood Boost. We can't call it that anymore. It's multi-nutrient. Our formula really builds your blood. Really, really, Tina, or Janet, sorry. But coffee doesn't affect iron. Okay? Eat more steak. Thanks, Janet. Tina, my GF, I'm saying your girlfriend, right? Okay? She says, my GF has bladder infections twice a year. Here's what's happening. Okay? Tina, here's what's happening. One, she probably, almost invariably, you can tell your girlfriend I said this. Okay? You got a yeast infection. The same thing that gets in the sinuses and makes them chronic is the same thing that gets in the moist area of the bladder. That's why women get so much recurring infections, bladder infections, because of the moisture. Okay? The anatomy in a woman is different than a man. And there's only two genders, by the way. Anyway. Why did I say that? I just got myself a headache. Now, okay? Now, probiotics. Tell her to get on probiotics, because probiotics, especially different strains and a multi-strain, will recolonize not only the gut, but the bladder. And lay off the sugar, because sugar feeds the bears. Okay? That's why you get recurring bladder infections. Okay? I gave her my probiotics. Well, good for you. Oil of oregano, very effective for that yeast. You see, oil of oregano is a natural antibiotic, natural anti-inflammatory, natural antiviral, natural anti-parasite, natural you name it. And it's an antioxidant too. Okay, let's do one more and then I've probably got to do some more. Tony is saying, I have a sauna most days, which temporarily raises my blood sugar. Will this affect my A1C? No. And then someone's asking, Nancy, that was Tony. It will not affect your A1C. A1C is an average. This is why I like it, because A1C is an average over 3 or 4 months. What happens when sugar, okay, left in your bloodstream, you know what happens to it? It hooks itself to red blood cells, okay? And it glycates, meaning it ages the red blood cell. And you can measure that. So the more sugar you have in your bloodstream, the more it attaches itself to the hemoglobin in red blood cells. You can measure it. That's the difference between because someone is asking, Nancy's asking, what is the difference between A1C and fasting blood sugars? Well, A1C I like better because it gives you a better indication because it's over a longer period of time. Okay? A1C gives you an average of this glycated hemoglobin, sugar attaching itself to the red blood cells. I like it because if you're over 5.4, you got insulin problems. You have insulin resistance. Okay, guys, I love you dearly. Okay, you know that. We'll finish up this. Okay? Keep your questions coming. I love it. I love it. I love it. Love you guys. Talk to you soon.